Hello and welcome. In this video, we will focus on the subject of psychosis. The term psychosis refers to an abnormal condition of the mind. It is a generic psychiatric term for a mental state often described as involving a loss of contact with reality. Hallucinations, delusions, and impaired insight may occur. The term psychosis is very broad and can be apparent in several mental illnesses, including schizophrenia and bipolar disorder, or in cases of physical brain damage or drug use. The next two slides will show a descriptive list of illnesses that involve psychosis. It should be noted that not all people who have a mental illness experience psychotic symptoms. Schizophrenia. A person has some psychotic symptoms for at least 6 months with a significant decline in the ability to function. Schizophreniform disorder. A person has some psychotic symptoms for less than 6 months. Bipolar disorder. With this type of illness, the symptoms of psychosis relate more to mood disturbance than to thought disturbance. Schizoaffective disorder. A person will have symptoms of schizophrenia and symptoms of mood disturbance either at the same time or alternating over time. Depression with psychotic features. A person has severe depression and symptoms of psychosis without the mania associated with bipolar disorder. Drug-induced psychosis. The use of drugs such as marijuana, cocaine, LSD, amphetamines, and alcohol can sometimes cause psychotic symptoms. Organic psychosis. Symptoms of psychosis may appear as a result of a physical illness or a head injury. Brief psychotic disorder. This illness usually lasts less than a month. It is usually triggered by a major stress in the person's life, such as a death in the family. Delusional disorder. This type of psychosis consists of very strong, fixed beliefs in things that are not true. Post-traumatic stress disorder. This usually lasts for more than a month and happens after a person has seen or experienced a very traumatic event. The person may have flashbacks or hallucinate. The reason why I talk about psychosis is because many people associate violence with psychosis. But here's what the Canadian Mental Health Association has to say about violence. As a group, people with mental health issues are not more violent than any other group in our society. The majority of crimes are not committed by people with psychiatric illness, and multiple studies have proven that there is very little relationship between most of these diseases and violence. The real issue is the fact that people with mental illness are 2.5 to 4 times more likely to be the victims of violence than any other group in our society. I recently came across another statement which I would like to read out for you. Violence is not a product of mental illness, nor is violence generally the action of ordinary, stable individuals who suddenly break and commit crimes of passion. Violent crimes are committed by violent people, those who do not have the skills to manage their anger. Most homicides are committed by people with a history of violence, and murderers are rarely ordinary, law-abiding citizens, and they are also rarely mentally ill. Violence is a product of compromised anger management skills. And that's a statement by Laura L. Hayes, who's a PhD psychologist in Bethesda, Maryland. And the reason I talk about psychosis and violence is because that is often a cause of stigma in our society. And of course, stigma leads to discrimination and prejudice. And I challenge you all to really look at the facts around mental health and psychosis and violence in particular, and realize that people with mental illness do not choose their reality, and they deserve support and compassion, not judgment. Thank you for watching this video.